All right, you are welcome back to the conversation segment. And as we said earlier, it's about health this morning. And there is a concern, a very growing concern about a particular illness called the HMPV, human metapneumovirus. Okay, possibly you're hearing it for the first time, but then it is what it is. HMPV for short, human metapneumovirus. Okay, and many persons are said, what do we know about these? And what is exactly HMPV? Some have said it's from Asia, some have said it's from China. You know, one will say China again, especially what happened with the COVID in the year 2020 before, the symptoms, the things we are seeing, the back and forth, the denial, the accusations and counter allegations, the politicization of the whole thing before, it was declared a public health emergency, I think in March 2020. And many persons are saying, is this COVID resurging again, or what exactly do we have on our hands? And with us in Africa, with us in Nigeria, do we stand a risk of this particular illness? And what do we know? We have with us in the house, physically in the studios with us today, Dr. Jibola Olagunoye. He's a consultant public health physician and epidemiologist. Good morning. Good
Good
to have you
morning.
here.
Good morning.
Thank you
for
very
having
much
me.
for coming. And just like I said, it's about HMPV this morning. And as we do on the program, we do it for information purpose, for education purpose, and of course for public awareness. Because as they say, as your profession says, health is wealth. And so, what do we know with HMPV?
Thank you very much. Good morning. Yes.
You're welcome.
Um, HMPV is a human metapneumovirus,
Mm.
and it's something that is gaining attention nowadays because of the outbreak in northern China. It's been with us actually.
Been with us.
It's been with us.
It's not new.
It's not
Sound
new.
to
It's
say.
not new. So those are the difference between heat and COVID because COVID was new when it came, but this was with us. I think it was first reported in 2001
Wow.
in Netherlands, and it's part of the common cold that we see, and it belongs to the same family as respiratory syncytial virus (RSV), which is actually common for common cold, and so it's something that's been with us, and it most times occurs during the winter period, the cold season. So that's what it is. But now that we're having more cases reported in China, it's gaining more attention because, of course, the awareness about outbreaks now. Before there's been outbreaks, but people don't take it serious. But after COVID, when you hear outbreaks, you're worried.
Yeah.
That's what's happening. So it's the same symptoms as COVID: fever, headache, cough, sneezing, runny nose, and the likes.
So, and every Nigerian will want to ask and say, why should I be concerned? You're talking about Netherlands, you're talking about Northern China. I'm here in Oshogbo, they're there somewhere in Jigawa. Why should we be bothered?
Okay, the world now is a global village. Travel here and there. You have a lot of Chinese expatriates working in Ocean, for instance.
Right.
So people come in and go. Although there are some measures put in place to make sure that it doesn't enter the country, but you never can tell. So you have to still be on the watch, on the lookout. Anywhere you are in the world, you are not, even if you're on another planet, people get to you. So now it's not like you're somewhere you can't be reached by these viruses.
So if it's only prevalent during the winter season, is there a possibility that when summer comes, it's also going to reduce?
Yes, there are a lot of diseases like that are seasonal in nature. Okay. There are different patterns to diseases. You understand? So when, for instance, even measles, take measles for instance, dry seasons you start having, you understand what I'm saying? So it depends on. So most times when it's the dry season, then it fizzles out. Even COVID is moving more rampant during the cold because you sneeze, all those habits is common in the cold.
Okay, so what could have actually triggered the increase in cases right now?
Okay, so mostly, of course, like I said, the season.
Yeah.
Then there's heightened surveillance.
Okay.
People are more aware. We are trying to look out for different things. So when you see any any constellation of cases, like you have cluster of cases in different places, you are worried. And you start research and start checking out what could be responsible for this. Before it's just like common cold, it's the flu season, everybody's going about their business. But ever since COVID, there's nothing like just the flu season.
So we shouldn't be, should I say, we shouldn't be worried or scared that COVID is coming again.
No, it's not. This is not COVID. Like I said, it's been with us before. Then there is no need for panic.
Okay.
Because one, it's not in the country yet, at least as at this morning.
Okay.
And
no incident case yet.
No incident case in Nigeria. Then the NCDC, I read their bulletin yesterday. They said they put some measures in place at the point of entry, the airport, wherever you can come in the land borders, so that if you have symptoms suggestive of human metapneumovirus, then they will just quarantine you somewhere and they will take samples and test.
Okay, how about the Chinese government saying that their hospitals are not cluttered? Like they are more like when he started, he said there were denials during the COVID season. So is this some form of denial again?
Well, as regards the Chinese, you never can really trust them because during COVID, they didn't really come out straight. The WHO kept asking for them to give us details of what happened. Even up to today, they've not given details of what it transpired at the beginning of the outbreak. So they've denied that there are no costs. Let's just take them for their words. The hospitals are not overwhelmed. Then
Should we actually take them for their words, considering the last time that we took them for their words, that it landed us somewhere we actually do not want to be, right? We did not want to be. So shouldn't we be actually looking out for more measures or more ways to actually limit ourselves from these people? Because the denial there is not really sitting well with Nigerians.
I understand it very well, but there are international health regulations.
Okay.
You can't restrict travel. You can't do stuff like that right now until there are other information out there. So we need those information to actually act. But all the same, based on the information we have, we're taking measures. Like I said, at our point of entry, we are trying to make sure that they are not just coming in without necessary checks. If you're coming in from China, of course, they will put it somewhere and they will ask you, maybe take a test.
So at what point are we going to say we've gotten to this elastic point where we need to take extreme measures?
Extreme measures, the last time you know where you got us. So you are very careful. You can't say you want to institute another lockdown at this point in time. You know, I don't think the economy can even survive another lockdown. So you can't take extreme measures yet. But of course, with time, if you see that this is getting out of hand, of course, we can actually, because our health is paramount.
That's right. Yeah. And let me ask now, the signs of the Hmpv, what is the cause actually? What causes it?
It's the virus itself, the Hmpv virus. That's Hmpv, that's the human metapneumovirus. It's a family of respiratory viruses. It belongs to the family of respiratory viruses. And the symptoms are just like COVID. Like I said, fever, sneezing, cough. And for people that are vulnerable, like people in the extremes of ages, the elderly, and the children.
Does it have anything to do with age, gender,
age
race?
majorly, then the level of immunity that you have. That's your immunity. If you are immunocompromised, then you are more at risk of having severe illness. And of course, it can complicate people that have asthma, for instance, because shortness of breath can actually occur, because it can lead to some lower respiratory tract infection, apart from the upper respiratory tract infection that we talk about, the sneezing and the cough and everything. It can cause bronchitis and even pneumonia.
Many persons, especially when COVID was ascertained and people were now aware of the disease and all of these things, people were so scared because of the time that immediately one contacts it. It takes a few days or possibly a few weeks, because if care is not taken, and some persons who even went to the hospital didn't survive it because of the space. Okay, like if it attacks you between 1 week, 2 weeks, you are gone. Is this Hmpv as severe as COVID as well?
So right now, the case fatality rate is not as high as we had in the early days of COVID. But now there is still no vaccine for Hmpv, and there is no treatment. And what we do is just symptomatic care. for people that have this kind of illness.
How do you mean symptomatic?
So if you have cold, we try to take care of the cold. You have fever, we give you some paracetamol for the fever. We make sure that the symptoms don't get, of course, don't overwhelm you. Most viral illnesses are self-limiting. What it means is that if you have a viral illness, a lot of people have had common cold without using anything and it goes, right?
Yeah.
So the same thing happens here. 2 to 5 days, it resolves on its own. If you have very good immune system. So we're talking about people having very good immune system, not immunocompromised, and people in the extreme of ages, of course, their immune system have actually depleted to some extent. What is important is you hydrate yourself, take lots of water, lot of fluids, then you treat the symptoms, and of course it resolves on its own.
On its own.
Yes.
Okay. Let me take antecedent. For example, you were in the forefront during the COVID push and all of these things. And my colleague, Uzoms, talk about, can we be more careful about all of these things, take precautions? Yeah, the NCDC has said we are doing what we are supposed to do. If that's at the national level, how about the state levels as well? And that's number one. Number two, very importantly, still speaking to, maybe I'll allow you answer this before I ask you.
So what has been extended is the National Influential Sentinel Surveillance System. The surveillance system, as they've tried to have different geopolitical zones, the Sentinel sites. These are the sites that monitor the changes in the amount of cases. Surveillance is just like trying to monitor whatever is happening. You understand? So if you can see, if you see a surge in number of upper respiratory tract infection or respiratory infections in the country, of course, we start looking and say, oh, something is getting on. But right now, there's nothing like that. So in all these zones, there are sites. There are some sites that have been picked. For instance, if, for instance, in UTH, University Hospital, you start seeing a lot of children coming in with cough more than we had before. Start wondering what's happening here. Then that would actually make us want to test more and see whatever is what's wrong with it. So that's what it's about.
Many persons are having cough right now. Does it have to do with that, or it's just the season and the dust and everything?
Now you've answered it yourself.
No, I just want to know.
So it's the season most times when you see.
The reason is, an average Nigerian will just assume some things to say, oh, if you're having some symptoms, it's because of this and that, and sometimes it could be more than that. That's why I'm asking that question.
So it's not okay to assume. And even at that, if you have signs and symptoms of, say, you're coughing, you take some precautions. For instance, you don't want to infect the next person. You can go around with your mask. You're coughing. Then the hand hygiene that we keep talking about is very important. You keep watching it, because when you sneeze, it can fall on surfaces, and another person will come and just pick it up and just ingest or rub it in the eyes or in the nose and everything.
All right. My other question is this. You said this is not entirely new. It has been with the human race at least since 2001. And then, people are talking about the Chinese and all of those things. You even said possibly was discovered in Netherlands and all of these things. So we have some of these persons, of course, what is a global village, we move around same way they too, they move around here. Many of them, these people, the Chinese and all of those guys, are involved in mining and all of these things around here. The way Hmpv works, you are the professional here, so let me just ask as a lay person, the virus, can it be in a person and just be there laying fallow? Because we learned there are some things that happen like that. There are some illnesses or diseases that even when you are not being affected by it, the virus or the causative organisms are in your body, and possibly it will take something for those things to be activated. Is that the way Hmpv was? So that we know that somebody around here might be moving around with it, only that they are not down with it.
Yeah, you're very right.
You understand what
you can have? It's called asymptomatic infections.
All right, thank you.
You can have infections without having symptoms, and for Hmpv, you can still spread it even without having symptoms, without having to. You understand what I'm saying? So it's like that. But the good thing about it is, it's a viral illness that doesn't last so long. It's not like you're going to carry it for months. Okay. So for within 10 days, we are not coming down infection. Most likely, the virus dies off within you if you have very good immune system. If you don't have very good immune system, then you can have more severe infection. You understand what I'm trying? So it's something that you can catch even without someone from someone that is not showing symptoms. And of course, someone can actually be a carrier kind of for the time the person is actually having that virus in them. So we still have to be on the lookout. Now that we know that something is happening, necessary precautions should be taken. Wash your hands as often as possible. Don't touch, don't pick your face, don't pick your nose, don't pick your. That's what I'm trying to say. If you have symptoms of cough, you're sneezing, then you have to observe the respiratory etiquette that we talk about. You cough into your bent elbow, you use an hanky, not that you just cough in the open or you sneeze in the open, all those. And you wash your hands frequently.
Okay. India has actually started a tracker for this virus now. Is it possible that somehow in Nigeria we could also have that?
So India have reported some few cases.
Okay.
So of course, when you start reporting cases, you want to nip it in the bud. So you are putting all these things in place. For us, we need to prevent it from getting to us.
Okay.
And the best way to prevent it is to actually look at those point of entries and see whether we can pick it from wherever it's coming from before it gets into the community as a whole.
What if there is a possibility that
it escapes?
Yes.
So if it escapes and we start picking cases, then we start taking measures. And one of the measures, like you said, is surveillance. So that tracker you're talking about is kind of surveillance.
Okay.
Like the tracker tries to monitor wherever you've been.
Okay.
Who you've had contact with. And the likes. We did that during COVID also. It's called contact tracing. Try to trace people that you've had contact with, the past, from where you're coming from, and the likes. It's a little bit tedious, but it's doable. With technology, of course, like you said, it's doable.
Okay. So how about the fear? Because there was this fear that was there during COVID. People had this fear, and now another virus has come in. What if because of that fear, some persons limit themselves or just hide away or shield themselves from going to the hospital if they have such symptoms?
So it's not advisable to die in silence when you have symptoms, when you have problems. But all the same, there is panic, there is fear that is associated with outbreaks. All the outbreaks that you see, of Ebola, of even the more deadly ones, there is panic, and panic most times causes more confusion.
Yeah.
So it's important that, of course, just take the necessary measures that have been said. Make sure that you prevent it by doing the things we mentioned. Wash your hands regularly. When you have symptoms or of any form of illness, go to the hospital so that they can check it out. It's not, because if you're not reporting, like you said, there's no way we can know if you hide.
So have there actually been confirmed reported deaths?
So most times the deaths have been from people that have other there's people that are immunocompromised, for instance. That's where the deaths have been reported from. If you have then extreme of ages, especially people that are less than 12 months.
Okay, so like I want to be certain, like the Hmpv virus has actually killed people. People have died of the.
So I don't want to raise any kind of panic.
Okay.
What I want to say is, any illness, malaria kills. Any illness can kill you.
Okay.
So it's not about it being like one deadly thing that can wipe a race out. But the truth about it is, any illness can kill. And when you present early, the chances that you survive is more. It's very high.
I'd like to ask categorically now, because as far as we are speaking truth to power, we're trying to educate the people what they should know. Of course, we are not trying to raise, tension among our people, but then we should speak the truth. As far as Nigeria is concerned right now, and Hmpv is concerned, can you categorically say there is no cause for alarm?
Yeah, I can say that. There's no cause for alarm. With the way we've handled this kind of occurrences in the past, if you know there shouldn't be any cause.
Okay, because Nigerians want to know.
No, we are not supposed to be afraid.
We have a lot on our hands right now. We can't afford to add any other pressure.
Then the case fatality rate, like I said, like the number of people it kills and likes is not as enormous that you should be afraid. Then it's not in the country yet. That's another thing that should make you, of course, rest. Of course, we should keep our eyes open. Be on the lookout. That's why they need heightened surveillance. If something's happening just there in China, for instance, someone just takes a flight I guess that's it. It's here already.
Exactly. That's the reason, because we tend to travel.
Yeah.
You know, everybody moves from one point A to point B.
Our Igbo brothers go to shop in China.
I'm telling you, with their 40-feet container, all of those things.
Yeah.
But now, that being said, we'll try and expand this conversation. We'll take a break, not quite far from now, very shortly. But before that, HMPV aside, this is Ocean State. This is Nigeria. And you're an epidemiologist. Are there things that people in Ocean, that's what I want us to look into after we come back from the break? Let me just give you a sneak peek. Like, it might not be HMPV. Are there diseases that we need to be on the lookout for in Ocean State, so that the people can know if it's not happening in China and it's not happening in Nigeria, the issue of HMPV, what are all those things, other things that we should look into? And that will be answered after now. Is Morning Spring on Western Spring Television, and our health is what we are discussing this morning. The HMPV, Dr. Olagunoye said there's no cause for alarm, although we must keep our eyes open and, of course, practice normal hygiene the way we should do. Don't be picky on everything, on your body part. Wash your hands, clean hands, and all of these things. But when we return, we speak to the issues that affect us here in Ocean State and, of course, in Nigeria, as far as our health is concerned. We'll be back.